Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic as it's impacting our region of Tennessee, Virginia, and the Appalachian Highlands for the week of September 20th, 2020. As I've reported before, the percent week-to-week growth rate in the United States has been coming down. Unfortunately, it's not getting as low as we've seen in some of the European countries. It's still growing at about 3% a week. That means each week there's 3% more deaths than there were the week before. If you look at Virginia, we were starting to see a pretty good trend where it looked like it was coming down pretty nicely. But it's been popping around a little bit. And this last week was 7.6%, a little more than we'd like to see. If you look at total number of cases in Virginia, it rose, dropped, rose, and now seems to be leveling off. As I've said before, I'm not a big fan of cases because it's very dependent on how many tests you run and who you test and how careful you are with your testing. So I like to look at deaths. And in Virginia, we've seen this very odd pattern, sort of what I call the bouncing ball, more deaths, less deaths, more deaths. And now it seems to be going back up again. And again, I think what we're seeing here is it's spreading into new areas, started in the large metropolitan areas, and then now seems to be spreading into the more rural areas. So this map shows you the evolution. Those are all of the cases that have been reported in Virginia, and now the ones just in the past 2 weeks. And you can see it's starting to impact the more rural areas, which we hope is a trend that we'll see continuing, that it'll slowly burn itself through all of the available areas. If you look at Tennessee, again, early on, it was doubling just like everywhere else, but it has been coming down, but really staying about the same in this 10% range. 10% a week is really a very significant growth rate, because that means, if you had 100 deaths, the next week's 110, the next week's 121, the next week 132, and so on. In terms of cases, again, it waited a while and then grew and now seems to be leveling off. I'm not a big fan of cases, as I've said, but if you follow deaths, it seems to be this slow and inexorable climb. In the last month or so, maybe some up and down, but no real significant change. So I think we're still in the midst of this growing pandemic. If you look at all of the reported cases in Tennessee, they seem to be, they were in the peri-urban areas, but in the past couple of weeks, very, very clearly evolving into the more rural communities. And I think this is sort of the nature of this pandemic, that it spreads from the big cities out into the rural areas. In terms of the Appalachian Highlands, in terms of total number of cases, again, it was growing fairly linearly and now seems to be growing pretty quickly with 42,000 cases and an 8.8% increase in the past week. If you look at deaths, though, growing quite concerned, and now having passed 600, almost 700 deaths just in our region, and a 13.6% increase in the past week. And that difference between the percent increase in deaths and the percent increase in cases reminds us that cases reflect testing. Deaths are pretty inarguable. Again, if you look at Tennessee overall, it showed this leveling off at around 10% a week. Our region is a little rougher, but roughly leveling off in the 10 to 15% range. So we're still in the midst of an evolving pandemic. It's hitting Tennessee, it's hitting Virginia, it's hitting our region still. We have to continue to be vigilant and to be focused on the things that we need to do. This is not the time to have any major changes in how we approach this pandemic. Tennessee has had 178,000 cases and 2,000 deaths. Virginia's had less cases, but more deaths. Again, they're not testing quite as much. And our region's had 42,000 cases and almost 700 deaths. This is a significant pandemic, the third leading cause of death in the United States, one of the worst pandemics in recorded history. This is not the time to let up. It's not the time to politicize. It's not the time to drop our guard. We need to keep focused on this pandemic. There's a great deal more information about COVID-19 on the College of Public Health website. If you click on this icon, it'll take you to a variety of other videos. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know at this email address or phone number. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. And as always, if you have any questions about COVID-19 or anything that I've said or any uncertainty, if you want to challenge something I said, please let me know. I look forward to hearing from you. Thank you very much.